Hello students, today we will discuss about the routes of drug administration. Drugs can be administered into the body through different routes. The choice of routes depends upon nature of drug and patient related factors like physical and chemical properties of the drug, tissue or organ to be treated, rate and extent of absorption of drugs and fates, effects of digested juices and first pass metabolism of drugs, urgency of the situations, accuracy of dose required, patient conditions, and etc. Routes of drug administration is classified into two types, systemic and local, and systemic is further classified into enteral and parenteral routes. Basically, systemic routes are the drugs administered through intended to enter blood circulation and distribute to the body and target sites. For example, oral tablets, capsules, suspensions, injections, and etc. And the local routes are the local drug administered through local routes act locally to the applied areas. The drug concentration is high at application site without exposing to other parts of the body. For example, topical ointments, lotion, cream, spray, drops, and etc. Now the systemic internal routes are oral, sublingual, and rectal. In oral, drugs are administered through alimentary tract. This is the most common route of administration. Only a few drugs are dissolved within the mouth, for example, sublingual and buccal tablet dosage forms. The majority of drugs are intended to be swallowed. The majority of these dosage forms are taken for the systemic effects resulting after absorption from the various surfaces along the GIT. The types of dosage form are tablet, capsules, solutions, syrup, suspensions, powders, and etc. In sublingual, the tablets containing the drug is placed under the tongue or buccal mucosa. Only lipid-soluble and non-irritating drugs can be administered through this route, and absorption is very rapid and action can be produced in minutes. For example, GTN. Now, in rectal route, drugs that causes irritation and have unpleasant taste while taken by oral route can be placed into rectum for systemic effect. For example, suppository and enema and etc. This route can be used when patient is unconscious or vomiting. Now, parenteral. The route of administration other than alimentary tract are called parenteral route. This route eliminates the factor of absorption since the absorption is injected directly into the circulation. And these routes are divided into four classes like injections, inhalation, and transcutaneous and transmucosal. Now in injections, our drug is administered parenterally in one that is injected through hollow of a fine needle into the body at various sites and to various depths. And there are four primary routes like subcutaneous, intramuscular, intravenous, intradermal, and in inhalation. Drugs can be administered by this route using pressurized meter dose aerosol, oxygen or compressed air driving nebulized solutions, dry powder from inhalers activated by patient inhalations. Drugs given by this route are quickly absorbed and produce rapid local and systemic effect. Sometimes local irritations may also result in an increase in the respiratory tract secretions and bronchospasm. Now third is transcutaneous. Certain drugs when rubbed into the skin can get absorbed and produce systemic effects. For example, nitroglycerine ointments in angina pectoris, like for chest pain. And the fourth one is transmucosal. There are two types of administration like sublingual and transnasal. And sublingual are tablets containing medicaments is placed under the tongue and is allowed to dissolve in the mouth. The active agents thus get absorbed through the buccal mucosa membrane directly into the systemic circulation. And in transnasal route, the is the important that no poisonous substance be administered by this route as it may reach the brain along with lymphatic channels. There are four primary routes of injections are subcutaneous, intramuscular, intravenous, and intradermal. Number one, subcutaneous. The drug is deposited in the loose subcutaneous tissue, which is richly supplied by nerves but is less vascular, and are usually aqueous solution or suspensions administered in a small volume or small volumes of 2 ml or less. They are generally injected into the subcutaneous tissue of the forearm, upper arm, thigh, or abdomen. And in intramuscular injections are performed deep into the skeletal muscle at the deltoid, triceps, rectus femoris, or lumbar muscles. Aqueous or suspensions may be used with rapid effects. Drugs that are irritating to subcutaneous tissue are often administered intramuscularly with volume of 2 to 5 ml or more. And in intravenous, an aqueous solution is injected directly into our brain at a rate of efficiency, safety, and comfort for patient with desired duration of the drug response. The drug may be administered as a bolus or infused slowly via a slow drip to maintain the blood level or to provide nutrients and drugs after surgery. And in intradermal, these are administered into the skin layer of usually in volumes of about a tenth of milliliter. Common sites are the arm and back where there is no hair, and they are frequently done for diagnostic measures. Now, the local route of drug administration is are of many types, like skin, topical, intranasal, ocular drops, mucosal throats, vagina, mouth, ear, inhalational, and transdermal, and etc. Now, the optic nasal route involves administration of drugs directly into the nose. Drugs are used